Hey everyone, this is Ben with Cholinergic and in this video I'm going to talk to you about some of the diseases that are out there that mimic cholinergic urticaria symptoms. So, a lot of people when they're trying to find out what's wrong with melanoma, they're trying to get a diagnosis and they'll kind of look at all these various articles and there are a few diseases out there that have symptoms of prickling and itching and tingling and so forth, and it can be easy to become confused. So I just wanted to cover a few of the disorders out there that are similar to cholinergic urticaria, but they're different, and there's some important differences. The first one is something that's called heat rash. Now, we sometimes refer to cholinergic urticaria as just heat hives because you have hives as a result of becoming warm or entering some sort of heat stimulus. But heat rash typically refers to what's called miliaria rubra, and this is a type of prickling and itching you can get when your sweat glands become blocked. Now, this usually happens in hot climates where people sweat a lot, and what happens is they'll get bacteria. They sweat so much, they get bacteria in their pores that will clog their pores, and they'll get kind of red, itchy bumps sometimes on their skin. And there's different types of miliaria. There's miliaria crystalline and profunda, and those all affect the sweat glands at different points. And they all seem to be related to bacteria or some blockage. Now, the difference between that and cholinergic urticaria, of course, is that miliaria tends to be self-limited. It usually clears up in a few months. You can usually treat it with antibiotics, whereas cholinergic urticaria, it tends to be chronic, lasting 6 months or more, sometimes as much as 7 years, decades. It could last a long time. Antibiotics don't do nothing for cholinergic urticaria in most cases. But miliaria is sometimes called prickly hives or prickly heat, and that's a disorder that a lot of people kind of get confused, I think, with cholinergic urticaria. Another disease is Tinea Versicolor. That's a type of fungus that you can get on your skin, and this kind of eats away at the melanin, I think is how it works. It eats away at the melanin in your skin, and it can leave kind of patches of white hyperpigmented spots on your skin or hypopigmented spots. And with this, you have a fungus that gets in your pores, and it can cause itching and that sort of prickly feeling. Usually, if you have this, you're going to know it because, they can use, I think, ultraviolet light, or they can scrape your skin and check it, but you usually can tell because the pigment in your skin will look different. You might have if you have dark skin, for example, you might have a big area of white little dots or patches, and that's usually what it looks like. You can look it up online if you want to see pictures of it, but again, that's usually a limited thing. They can treat it with antifungals. It can go away, whereas cholinergic urticaria, they have a difficult time treating that sometimes. Another one is mastocytosis or urticaria pigmentosa. And what that is when you produce too many mast cells in your body. And that's a pretty serious disorder because some people, they get so many mast cells built up on their body, and it can actually eventually lead to death. And it can be very uncomfortable. Sometimes people will get kind of like leopard-like spots almost. They have so many spots on their skin. And usually those are lumps of mast cells, and if you scratch them, they'll itch. So if you have a lot of lumps on your skin, or almost like a cheetah pattern or dark spots, that could be mastocytosis or urticaria pigmentosa. And again, you can get itchy and prickly with that. So, that's another disorder that is sometimes confused. It is different than cholinergic urticaria. And you can have sometimes two of these disorders that overrun each other when it comes to the different types of hives and allergies and so forth. Exercise-induced anaphylaxis. That's another thing that some people kind of get confused with cholinergic urticaria. And what this is, people will experience hives, wheals, and flushing, and even anaphylactic shock when they do physical activity. And what's different with this is that this only tends to occur with passive heating, with active heating, which means that you're doing a physical exercise or doing something, physically strenuous. Whereas with cholinergic urticaria, it can happen whether you're doing physical exercise or if you're just passively sitting on the couch and the room becomes hot, you can break out in hives. So that's the difference with that. And by the way, they do find that some of those cases of exercise-induced anaphylaxis is also associated with food issues. And several articles have pointed that out, that some people have like wheat allergy or something, and they notice if they eat wheat and then exercise, then they experience exercise-induced anaphylaxis. Febreeze disease is another disease. It can kind of make a tingling sensation in your extremities, and that occurs because your body can't break down a certain type of enzyme. And the fats accumulate in your body. So, you know, if you're having pins and needle sensation only in your extremities, you could look up Febreeze disease and see if, you know, or talk to your doctor about it and see if you feel like you have those symptoms. Niacin flushing. If you eat too much niacin, either in your diet or if you take a supplement, you can get flushing from that. And that's, again, where the blood flows to your skin surface, making it warm. It can be itchy, it can be red. And niacin flushing happens with that. So that's different than the flushing you get with cholinergic urticaria in the sense that there's a different mechanism causing it. And that summarizes some of the most common diseases out there that someone might confuse with cholinergic urticaria. Sorry. And those are some things you want to keep in mind if you're still trying to self-diagnose or find a diagnosis. You know, it's easy to get confused looking at these different articles. So those are just some things that you might want to think about when you're looking at your symptoms and talking to a doctor about them. So I hope that helps. In the next video, I'm going to talk a little bit about some of the other diseases that can, or some of the other skin conditions and diseases that can sometimes occur alongside cholinergic urticaria, and you might have that. So thanks a lot for watching.